Good morning, my angels. I hope you are doing well. I am doing so well. I'm feeling very Cuban in Miami today. I'm wearing a guayabera and a 3-year-old Michael Kors watch. It doesn't get more Miami than that. I am Juan Torres-Falcon, and this is in just 1 minute. Our great nation is in the midst of a healthcare identity crisis. So today I'm going to break it down so you can stop pretending to know the difference between Medicare and Medicaid, and referencing Grey's Anatomy as a really cool way to do it. I love the energy of their insurance. Modern insurance, as we know it, began when Blue Cross offered medical coverage, before it had the Shield, to a small group of people for a monthly fee in the 1920s. Medical insurance would become a commodity to attract people to work at a company. That certainly hasn't changed. In 1965, President Johnson tried to create a single-payer healthcare system. Okay, let's clear this up. A single-payer healthcare system is one in which one person pays for everybody. Like when my mom takes me to Cheesecake Factory, it's a single-payer system. I order the crusted chicken Romano and 2 servings of Craig's Crazy Carrot Cake cheesecake, but she pays singly for the entire thing. Think of our friends in Canada or Great Britain using tax revenue to pay for the entire health insurance gag. President Johnson didn't make it all the way to a single-payer system, but his precious twins, Medicare and Medicaid, would go on to define American healthcare. Medicare cares for Americans over 65, for your abuela and abuelo, and certain younger people with disabilities, and people with end-stage renal disease requiring dialysis or a transplant. You pay into this with every paycheck, and it's waiting for all Americans when you turn 65, rich or poor. It has a 90% satisfaction rate. Nothing gets a 90% satisfaction rate. I'm not even 90% satisfied with Mariah Carey, and I would donate bone marrow for her. Medicare transformed what growing old looks like in the United States. Before the initiative, 1 in 3 elderly citizens lived in poverty. Way to go, Medicare! Medicaid is a federal program that is funded partially by the government and administered by the states. It benefits about 70 million people. Those who can't afford health care, children and our most vulnerable citizens, pays for half of the children born in the United States and all Americans living on disability. Tomorrow we will look at how we got to Obamacare, what's wrong with it, and what the GOP is hoping to do next. By the way, happy birthday, Khloe Kardashian. You turned 33 today. We're almost the same age. And you are rich and famous and skinny. And I bought more toilet paper today. This has been In Just 1 Minute. I am Juan Torres-Falcon. Bring a smile to someone by having one yourself. I'll see you tomorrow.